Well, as the eye ages, there's a lot of things that can happen. The most common is cataract, which we all have heard of cataracts. Cataracts usually start becoming evident in the 60s, early 60s, late 50s sometimes. There's many different types of cataracts, but in general, the age-related cataract, average age for cataract removal is mid-70s, average age. But it has the oldest I've ever taken out was in a general from World War II who was 101. This is like 35 years ago, 101, and he finally had a cataract. But cataracts are today, with the surgery we have, again, this is remarkable surgery due to technology, it's a fairly rapid surgery, about 15 minutes. It's extremely accurate with the technology we have to measure the eye, to measure the lens we're going to put in. So cataract is something that everybody's going to get at different ages, but in the 70s usually. But we have a very good solution. We have a whole new generation of lenses that allow people to see far away as well as close up. The lenses can take care of such things as astigmatism that everybody has. So today we're really on the edge of, in fact, today we talk of cataract surgery as being refractive cataract surgery, because people come in, they wear glasses, we can fix that. Not only get rid of your cataract so you can see better, but also basically get rid of your glasses at the same time. Glaucoma is a very complicated disease. I won't get into the details, but the essence is generally you have high pressure inside the eye, what we call intraocular pressure, and that high pressure damages the optic nerve. So the disease is really the damage to the optic nerve. The optic nerve you can think of as a coaxial cable connecting the retina, which takes the light and turns it into electrical signals, connects the retina, like film, to the brain. You're aware of vision, not in your eyeball, but in your brain. So the optic nerve is key. Just like on your TV, if you have cable, you damage the cable, you don't see so good. And that's the same thing in the eye. So preserving the optic nerve is very important, and that's why glaucoma is such a serious disease. The problem with glaucoma is there's no symptoms. It doesn't hurt. It doesn't affect their vision until the end. And by the time it's affecting their vision, it's very late in the disease, and it's kind of the game's over at that point. But while it's doing its work, you don't notice it because it starts in the periphery and gradually comes in terms of the visual loss. So by the time they come in and they're seeing just this part, it's usually toward the end of the disease process. We have to catch this disease early. Fortunately, it's a very slow disease. It takes years. And so if we screen people, which today more and more people are getting eye exams, we can usually find it early in its history. And there's a lot of things we can do for it to prevent actual blindness. But it is a blinding disease if not treated at some point. Well, yeah, there's another set of diseases that comes along with having diabetes. Diabetes, as you know, well, generally our nation is in the middle of an obesity epidemic. Just walk down the street, you'll see what I mean. With obesity, adult obesity, comes diabetes. And with diabetes comes what we call microvascular disease of the capillaries, the small arterioles, basically the blood that supplies the tissues. And all over the body, people who have diabetes, they're having problems getting oxygen to the tissues. This includes the brain, the retina in the eye, your heart, your kidneys. Every organ is affected by diabetes. Very slow. It just starts very slow. People don't even realize what's happening. But we see that starting in people in their 40s and 50s. And one of the big problems is the eye. And what happens in the eye is the same thing that's happening in the brain. It's the blood supply at the capillary level is being interrupted, and the tissues of the retina, meaning the photoreceptors, the nerves that take the signals back to the brain, are being damaged by lack of oxygen. What we call focal ischemia, a little bit at a time, little spots. But over time, that spreads. And so diabetes is actually a blinding disease as well. Now today, again, because people, doctors who treat diabetics say you got to get your eyes examined. And so they get into and we see them every year, every 6 months, whatever it takes to make sure they don't develop diabetic retinopathy. At the first sign of diabetic retinopathy, there's things we can do. But the thing is, if people have to learn to control their weight to prevent these things. We can treat diabetic retinopathy, but we're putting our finger in the dike. It's still encroaching. and they have to take responsibility and work on their weight control. It's very difficult to do, very difficult, but that's the essence. All the medicines by mouth, the insulin, all helps, but the enemy is weight and lack of exercise. And so weight control and exercise are in my opinion, are the foundations of diabetic control and the foundations of preventing diabetic retinopathy and blindness. Very common, not just people with autoimmune disease, but as we age. Now, the young people, they don't have this, but as we age, people get dry eyes. Why do they get dry eyes? Well, it's complex, but part of it is that many people have a disease of the oil-secreting glands in their face, all over their body. These glands get plugged. And the same thing is true in the eye. And in the eyeball, when the oils cannot secrete out of the glands in the lids, then the way this works is the oil film on top of the water keeps it from evaporating. You put water on something, especially like here in Kansas, it's fairly dry, it evaporates really fast. So if you don't have that oil layer, you're going to have dry eyes. So that's a real important disease because a lot of people suffer from dry eyes.
And that's something that you can correct?
We can't, well, we treat to a degree. We try to treat the meibomian, those are called meibomian glands. We try to treat that, but it's really not a lot we can do for that, other than keeping the glands open and doing various things to try to do that. But basically it's using eye drops, either a tear, or we have another drop that is an anti-inflammatory that tries to get the glands to secrete more tears by overcoming inflammatory influences on them. So it's complicated. There's a lot of things we can do, but we can't cure it. It's like glaucoma. We never cure it. We just treat it. We prevent it from getting worse. Same with diabetic retinopathy. We can't cure it, but we treat it. Cataracts are the one thing we can cure.